Hi everyone, and welcome to the first episode of Palliative Care Talks. This is a web series which talks all about palliative care. It's run by the Palliative Care Voices network, which is set up to get patients, carers and families involved in palliative care advocacy. And today we're joined by Sharon Thompson and Stephanie Nimmo. Do you want to introduce yourselves?
Hello, hi. I'm Sharon Thompson and I'm from Ireland. I live in Donegal and I'm involved with palliative care because our daughter Victoria developed a rare disease, and she was diagnosed as terminally ill when she was 5 months old in 2011, and she passed away, unfortunately, in Ireland's only children's hospice in June 2012. So that's me and Victoria.
You, Steph?
Hi, I'm Steph. I live in London and I'm involved with palliative care because my daughter Daisy was born in December 2004, very prematurely, and not long after found to have a rare genetic disease that was life-limiting. She was referred to a children's hospice from 6 months. And then she was referred to hospital palliative care at the age of 7. She died last January in Great Ormond Street when I had to make the decision to switch off her life support. And I write a blog called Was This in the Plan? Been writing it for 10 years now. And then I also wrote a book called Was This in the Plan? And do a lot of work around reframing a lot of the narratives around children's palliative care.
You have also experience of adult palliative care as well, don't you, Steph?
Absolutely, yes. So also, sadly, a year before Daisy died, my husband died of stage 4 cancer. And so, because we had been living knowing that our lives were finite, in some ways that almost prepared us to know how to live with Andy's terminal diagnosis. And then he was referred at the very end of his life for hospice care. So yeah, I've seen it from both sides of the spectrum, very, very different. So yes, that's me, Steph, in London.
And I'm Lucy. I have a life-limiting condition myself. I've been under palliative care since I was 17 after doctors skirted around the issue for quite a long time, I suspect, but I've been under a young adult hospice. Very fortunate to live in an area with a young adult hospice because it's quite a new area, but I also benefit from a local joint hospice and adult palliative care team. So yeah, that's kind of me. So I thought we could start off by kind of saying what palliative care means to you.
For me,
Yes.
Palliative care, and I've done a lot of writing about this, and obviously within the UK there have been some really, really high profile cases this year and last year, and a lot of public misconception about what palliative care means. For me, having personal direct experience, it was never ever about giving up. We accepted from day one that Daisy was going to die young, and we also accepted very soon, when Andy was diagnosed, that he was not curable. What palliative care gave us was the ability to focus on Daisy's quality of life and to make sure that the time we had with her was the best possible time. So for me, palliative care, in some ways, it's been given such negative connotations, and because of these high-profile cases. But for me, palliative care was actually such a positive thing. When we were offered hospice support, we were struggling, and that enabled us to really focus on Daisy, our family, keeping our family together and strong during this time. And then when the hospital palliative care came on board, it was about looking at what could we do to just make sure that Daisy's wishes were supported. And all Daisy wanted to do was be a little girl, go to school, be with her siblings. And so working with our team, we looked at whole pain management regimen, but also then my husband and I were able to have really, really open and difficult conversations about how we would cope, at Daisy's end of life, which ironically was so crucial because I was there at the end on my own, but I knew that we'd have those conversations. So for me, it's a positive thing, always will be.
What about you, Sharon?
Just everything really that Steph said. I was nodding away and totally with you there. Yeah, our experience of palliative care was that Victoria was in a lot of pain, and we were in the hospital, and the word palliative was mentioned to me, and I didn't know what it meant. So I'm coming from that place of not having any idea of what it meant to finding that there are very little palliative care services in Ireland for children. There's very few. If there are, they're mostly charity based, and it all depends on your location. So for me, palliative care there's a lot of gaps that we have to fill, but for us, palliative care was a positive. It was definitely, as Steph says, about not giving up. Palliative care isn't giving up. It's just a new specialized pathway of care, really. And again, my experience, I am no expert. I just know that for us, the words palliative care meant that we could make memories. We were together as a family, and Victoria had what I call a safe death. And we could talk about death and dying, and we still talk about her, and we can smile because we feel that she had the best care that she could have had. So that's really what palliative care is for me.
And obviously for me personally, palliative care has enriched my life. It's given us time, it's given us conversations, it's given us planning. And actually the thing that always surprises people is my advanced care planning, which people associate with death, was more about living than about dying. And it helped me refocus my life. I'd lost a lot of things. My life had changed so much. And then suddenly people were saying, what do you want to do? What matters to you? And how can we support that? And actually I was given a 5-year prognosis in 2012, and I'm still here, but I put that down solely to palliative care. Obviously the nutrition I have and all the different interventions I have keeps me alive, but what's kept me going is palliative care and having pain relief, having quality of life, but also support from my mum, my sister, my family. I think that's it. People forget that palliative care is for the whole family. It's not just for the individual. And palliative care to me means quality of life, comfort, and living life to the full.
Yep.
Palliative care is quite a misunderstood topic. What do you feel is the biggest misconception about palliative care in your words, Steph?
I think the biggest misconception is about it's associated with an imminent end of life. And I think that's why in many cases people are unwilling to engage with palliative care, because they think that means my child's going to die. That means the person in my care is going to die. That means I'm going to die. And that's not always the case. In fact, the majority of cases, it's not. It's actually about, and I always say it's about quality of life. But I think the misconception is, this is it. I've only got days, months to live. And I think because we had educated ourselves around palliative care, we embraced it. And I think that's where some of the difficulties have lain with, as I say, some of those recent cases that people have just assumed, it's about switching off life support. But it's about preparing for a good death. I mean, as you know, I always say, the only thing we have guarantees in life is that we're going to die. And in a way, with Daisy, we absolutely knew that time with her was finite. And what palliative care really does is enables you to look at, okay, finite time, how can we make the most of this time and manage symptoms? So yeah, the misconceptions are that's why these conversations are so important and really need to be reframed.
What about you, Sharon? What's your biggest misconception that you find?
Yeah, I think that just what Steph was saying there, that when you hear the word palliative, you think it's imminent. And I suppose we did too at the start. We were waiting for she's going to pass away today. You do go through that, but it's not like that. And it shouldn't be. It should be that people talk about palliative care and hospice. I know that in Ireland, there's great understanding of what hospice is in adults. But perhaps we think of it as well, as Steph was saying, that it's for the end of life, whereas it should be sort of from the diagnosis of a life-limiting illness that you are preparing, you're planning, you're talking about it. So I suppose the misconception is, again, that it's not about that because you decide on palliative care that it's not giving up. You're adding things to life rather than taking away from them. So I suppose that's the misconception I see.
I totally agree with you both, because I talk to people and I say, I've been under the hospice since I was 17. Oh, you're going to die very imminently. And it's like, well, I could do, but I could not. And there's no saying when I'm going to die. And I've already, as I said the other day, I've outlived my expiry date. So past that. But I think the biggest misconception for me is that, as you said, palliative care is giving up, but palliative care is like ending life in a way. It's like giving up treatment. Like, you're going to end your treatment, you're going to just wait to die, and that's the end of it. And it's like, no, actually, you're adding quality. Like you said, it's adding to life, not taking away. I think that's a really important way of putting it, actually, that, we're adding good things to the end of life, however long that may be. And like for me, I've been under palliative care over 7 years. A lot of people don't have that. Daisy was under it for almost 12 years, under the hospice. So, that it's not about how long you have left, but what you can add to however long that is. And like you say, the only thing that's guaranteed in life is death and taxes. So, we've got to talk about it and think about it, but reframe that narrative that palliative care is not giving up. It's not ending the life. It's not, giving up on life and giving up and not doing anything. It's actually doing more in life to make the end of life more comfortable.
Yeah.
How would you explain palliative care to someone that knows nothing about it?
For me, I have these conversations a lot now, and you kind of have to get over that initial, when you tell the story, people's shock, and we were talking about this earlier, and I think, I explain it because I tell Daisy's story, and I tell it in a positive way, and I think people look at me and think, I didn't think of it like that. So, I talk about her being referred to a hospice at 6 months, and people are really shocked. It's like, oh my God, she must have been so ill. It's like, well, no, because actually at that time she was reasonably stable, although we knew that there was going to be an end point. And I share, all the positives that gave us. That gave us an opportunity to plan and discuss. I share about how the children were supported and how we engaged in family conversations about what we wanted. And then I also talk about how being under palliative care allowed Daisy to do the things that she really, really wanted, because she was so determined. Despite a learning disability, despite minimal speech, she knew what she wanted. She wanted to go to school, be with her friends, go shopping. And, having good symptom control, which palliative care gave her, enabled her to do that sort of thing, and enabled her to, us to make some really important and special memories. But also, palliative care enabled us to give her a good death, and enabled us to give her good dignity in death, which was just so crucial. So although we were never able to predict where, how, when she would die, because we had very open and difficult conversations, despite the fact she was on life support and in hospital, I still absolutely believe that we gave her a good death because we had prepared and planned for it. So I talk to other people about palliative care by sharing the story, and you can see people do recoil, but I think we all do in this community. We have to talk about it because we have to absolutely change this perception and show the positives. Anyone that's been to a children's hospice knows it's such a positive, happy place, and yet people are really scared. They think it's going to be full of, families weeping and wailing and children looking really, really ill, but actually, it's full of laughter. And as I say, even that's what gave me a lot of comfort after Daisy died, that because we'd had all that preparation, going through grieving now, I can still reflect back and know that I did the best thing for her. So for me, it's always about, when I talk about palliative care and explain it to people, it's always about sharing the positive stories and what it gave us as a family.
What about you, Sharon? How would you explain it?
Yeah, just it's very similar in that I explain that palliative care is about supporting people probably in their darkest days, but at the same time, it's making sure that families are supported when they're in our situation, when our child was diagnosed with something terrible. I expected, the first thing I said was, well, where do I go? What do I do? And unfortunately, we had to find the hospice ourselves. We were lucky in a way because we could go to Dublin with Victoria because she was our only daughter. And we live an 8-hour round trip from the only hospice here in Ireland. So, in a way, we were extremely lucky. It was only opened the day actually she was born, so they're exactly the same age. So it was very new, and again, they were finding their feet. So my experience of palliative care is that it's in its infancy in Ireland. So to explain what it is to people is difficult, but I suppose it's about the whole support to ensure that people who are very complexly ill or have complex illnesses have a good death, as Steph said, and that everything building up to that prepares them and their families for all of the joys that they can have and all the memories they can make before it happens. I think everyone's scared of talking about death, and I suppose the whole point of palliative care and talking about it like this is to say, yes, it's scary, yes, it's not nice, but that it's a conversation that we have to have and we have to keep having, and it's okay to talk about children who are sick, children who are dying, and that we have to do that, unfortunately, because we need to make plans and services available for them. So that's my preach.
No, and I totally agree with all of you. It is sharing that it's about making the most of whatever time you have. So that might be weeks, it might be months, it might be years like me, but actually whatever happens, you're making the most of that time. And then when the time does come for the life to end, everything's in place, everything's sorted. Your family can concentrate on just being with you, enjoying that time and making the most of it. And I think actually having conversations now saves a lot of heartache at the end. It's a bit like talking about organ donation. People don't talk about it. Therefore, when they are in a situation where they could donate, the family go, oh, no. And actually that person might have wanted it because they didn't have the conversation. It wasn't done. And I think for us, it's allowed us to think about something so horrible, but turn it into something actually quite positive.
Yeah.
What was the most important thing you think to say as a palliative care advocate?
As a palliative care advocate, I think the most important thing to say is we need to take the fear and the misunderstanding about talking about death and dying. And as I think we've all said this, I think, and it's kind of a bit of a northern hemisphere thing anyway, that we just don't talk about these subjects, and yet it is the only thing we have guaranteed. People are afraid to talk about it. They're also even more afraid to talk about the fact that children and young people die. And that is the reality. And I think we need to have those conversations. We need to, but people like us need to be leading by example by saying, yeah, it happened. But because of palliative care, the worst possible thing in my life, I lost my daughter, I had to switch off my daughter's life support, was eased by the fact that I was supported throughout that process. And particularly because I was on my own at the end, I was supported by people that knew me, knew my child, and we gave my daughter a good death. And despite the fact that the most unimaginable thing that has ever happened to a mum has happened, it can never happen to a mum, it's happened to me, I still feel very, very comforted by the fact that we prepared for it, we talked about it, and we gave Daisy the best possible life, even though it was a short life, and the best possible death. We did everything for her. And I think that's, as advocates, that's what we need to do, is keep talking and keep having these conversations and sharing the positives to try and also counterbalance so much of the negative. As I say, when you have these big public profile cases and everyone weighs in with their opinions, that's where it's really important to show the reality of what palliative care can do.
What's the most important issue for you think, to raise as a palliative care advocate, Sharon?
There's so many. I suppose because I'm still in contact with mothers, or who are in the bereaved category, and I say that with a smile, and people think you get very used to being very blasé about the most horrible things, but because I'm in contact with other mothers, I suppose, and other mothers whose children are still with us, I suppose that one of my messages is, look, I'm okay. I have my bad days, but I'm okay. And the reason that I'm okay, and the reason that I'm at the other side of it, and I can talk about Victoria and I can fight for others, I suppose, is because because of her palliative care and her experience. My message, I suppose, is that Victoria had the best care, thanks to her hospice and the wonderful nurses. She had the best care, and that every child deserves that care. So I suppose that's kind of what I have to keep saying, and to show people that it's okay to say, you know, I mean, one of the things that I find, I don't know if the rest of you find this, but you're supposed to grieve and move on. You know, one of these things, oh, it's not healthy that you're, you know, you're still caught up, you know, in talking about palliative care. You know, maybe it's more healthy if you move on, but to me it's healthy to want to change things for others who are in the situation or who are going through it. So I suppose it's healthy to be involved and to stay involved, and you will be okay. Your child will make sure you're okay. They'll give you strength.
Well, I think that's it. It's another issue is actually we make meaning out of what happened, not just for ourselves, but for others. You can turn a horrible period of time and actually say, look, now it's made a difference for all these other people. And I find that very comforting, that, you know, my struggles and my issues that I've faced can then benefit someone else. People, you're still talking about it. It's like, yes, I am, because I have to. And one of the things I say to people is be brave and talk about it. You know, it's hard conversation. It's something people don't want to talk about, but be brave and do it, because you'll benefit from it. And it's actually a relief when you do it. Anything else you wanted to raise?
I mean, I'm just shocked hearing Sharon's story that there was only one hospice that they were able to access. And, you know, I am so aware that it was almost an accident of birth that Daisy was born to us in London, when we had on our doorstep an incredible hospital that already had a fully staffed up palliative team and a hospice. And I took that for granted until I started talking to other people. And I'm so aware that our situation is definitely not the norm, you know, in terms of the early intervention. So I think, you know, I think all of us, it's really important, again, to keep sharing, because we need to ensure that the people who have the money and the funding and can make decisions make the investments in children's palliative care, and the support, because out of the other side you get families that, you know, have a positive experience. You get children that are able to cope with the fact that their sibling died. So, you know, I think we all have a role to play in constantly sort of banging the drum that investment needs to be made, and we can't constantly rely on the charity sector as well.
Yeah, very similar things, Stephanie. I just feel that the situation in Ireland, if Victoria was born today in 2018, she died in 2012, and despite all of the wonderful fundraising and all of the shouting from the rooftops that I've done and others have done, if Victoria was born today, we would probably be still in the same situation. There thankfully are some new nurses coming on board, children's palliative nurses, thanks to the new course. There's a new course in Ireland in NUIG in Galway. It's called Children's Palliative Care and Complex Care, and it's a master's and a postgrad. So we have nurses coming out into the communities of Ireland. But if you can imagine the geographical spread of, you know, we'll say Scotland, or, you know, we're talking about rural areas. So, and you're talking about one nurse for huge geographical areas. And again, we're fighting for more of them to be paid by the health board and the government, etc. So there's so much that needs to be done in Ireland for children who are life limited. I mean, there's no respite. There's nothing. So, and you're talking again about long trips for appointments in Dublin, lack of specialised, lack of knowledge really about children's palliative care, even with medical professionals. So, you know, I mean, as you say, it's just a case of banging that drum and making the connections. I mean, we have wonderful charities in Ireland, and I mean, I could list them all, but we need for the government to sort of step forward and say, yes, these are the plans, these are how we can help. And I suppose to ask other parents of life limited children to not be afraid to talk up. I mean, there's a great force in Ireland of wonderful mums getting together now, and they're trying to do it in a positive way. So I suppose it's all of that, just to keep banging that drum, as you say, Stephanie. Yeah,
definitely. And I think I feel a sense of responsibility to do it as well, which is, that drives me in a way, because I feel responsible to speak up. That keeps you going even when it's tough. And I think it's really important, you know, we have the knowledge and the information and the contacts to make a difference, and if we don't, nothing's going to happen.
Yeah, I think it's to tell everyone out there as well who is involved in the medical profession. There are these wonderful positive mums and advocates like yourself, Lucy, all over the place, who want to engage, who want to help, who want to be voices of reason and to bridge gaps and to make connections and network. We're not here to be, how would you say, militant or to fight the system. We're willing to work within the system, but we have to be included and asked our opinion, and for that to lead on to change. Because I think sometimes as well, we're rolled out to make people cry, and I suppose, without being negative, I don't want to end on a negative, but you know, to make people cry, to put money in a bucket and then go back in your box. You know, there's so much positivity and wonderful things that the likes of us could do, other than make people cry. You know, we can actually be a force of good and empower us, basically.
Pick up on that one, absolutely, because people are always saying to me, oh, Steph, you're such an inspiration. That's fine. I don't want to just be an inspiration. I want to make a difference. I want to make sure that all those other kids coming down the line, those young adults that are leaving children's hospices and surviving longer, still get the support and still get a positive experience. So yeah, you can have your inspiration if you want to fill the charity bucket, but actually it's about doing, isn't it? And I think we've got that energy, and sadly also we have the time now, so use it.
Yeah, exactly.
Well, thank you both so much for doing this today, and I hope everyone's enjoyed watching it. Please do engage, share, like, comment, and we'll see you again soon. Thank you.
Thank you, Lucy. Bye, everyone. Bye.